So we talked a lot about, you actually biopsy the specimen and then decide do the GEP for predicting mets or lymph node. But I know there's another company out there, and that basically you put the tape strip of the moles and then try to tell you whether or not something that should be biopsied or not biopsied. What is maybe you can explain a little bit about that technology and what is your feeling on that, basically?
Yeah, that's the pigmented lesion assay from Dermtech. So that's a diagnostic test. So it's trying to help you decide, should you biopsy a lesion or not? How likely is it to be a melanoma? Whereas the GEP is the diagnosis has already been made, and it's trying to help you predict the risk of metastasis to then do something, for the patient. So the tape stripping, it's a very innovative, easy to use technology. It does have a few pitfalls. First of all, you don't get a result immediately. It takes about 4 days to get the result. So you apply the adhesive tape and then you send it to the company, and then it's a couple days to get the result. So the patient has to then go home, and then if it's positive, you then have to bring the patient
back,
to do the biopsy. Which I'm in Utah, and some of our patients drive 5 hours to see me. That's not going to be so practical. Advantages of the test: it can be done remotely. During COVID, a lot of patients didn't want to come into the clinic, and maybe they had a lesion that they were concerned about, and you can arrange to have the test sent to them and instruct them how to use it, and then they mail it in, and then you get the result, and then decide if the patient really needs to come in or not. The ability to detect melanoma is pretty good. So the test is fairly sensitive, but in some cases, it's not always very specific. And so it might lead you to biopsy lesions that you wouldn't otherwise biopsy. And so I think in my clinic, if I have a patient who we're monitoring with total body photography, and looking for a change in a lesion based on that system comparing to a baseline photograph, to me, that's I find that more reliable than a tape test. But if it's a new patient coming in, or you don't have any photographs to refer to, I think it's reasonable, particularly if there's a lesion you're not concerned about, but the patient is concerned. It can be a very good way to reassure the patient that the lesion is okay. It's been shown that the test has a very good negative predictive value. So if the test is negative, there's a 99% chance it's not melanoma. And so if you're not worried about the lesion, but the patient is, you could tape strip it to get the negative result and then reassure them. Always with the caveat, they still need to monitor the lesion. And if it does change, they still need to come back to you. But if the test is positive, then it's not always melanoma. So it might cause you to do more biopsies.
So, yeah, that's what you mean about it's very sensitive, but
yeah. And so I think you have to decide, in your practice and for what type of patient the test might be most appropriate. I'm not sure it's ready for primary care. The test was developed and tested on high-risk patients for lesions that were suspicious for melanoma, and then to start putting it on seborrheic keratoses and lentigos and things that, or other things you might see in primary care, not knowing what you're dealing with. We haven't really studied it in that clinical setting.
Yeah, I think the prevalence.
So I think you have to think about sort of how it was developed. And
no, those are very, very. I mean, I think I use. You and I sort of worked in the same way, right? We're using total body photography, we're using dermoscopy, we have a certain way of tracking them. But I agree that, I think those tools are very, very valuable. If I see something that I'm, really concerned about, the probability of this is a severe atypical nevi melanoma, or it's pretty high up. So the diagnostic accuracy is pretty high. But I think it is kind of useful sometimes for patients, especially young women on the cosmetically sensitive areas such as the face. They don't want a biopsy, and this is one way of sort of bridging that process.
Yeah.
Well,